I want to dive into that a little bit later because that is a unique model. But I do want to bring this up because it was the question I had in my head. It is an election year. It's a presidential election year, and we have all of the same. We have the talking points that we've had around the economy and security and all of that. Healthcare is always one of those. Now, it might not be at the forefront like it has been in the past. There's other things going on as well. But how, where from a national standpoint, what are the challenges for healthcare in our country? And I remember that
How
was
much
a
time do you
large
have?
question. Narrow it down maybe to the top one, but what do you see maybe as the biggest challenge and maybe a solution?
In my view, one of the solutions is better diet and more exercise.
Yeah.
It's plain and simple. Our food intake and our nutrition is relatively poor, and we don't exercise enough. Those two things alone could save probably billions. And they're simple, but they're challenging in their own ways, right? I vividly think that we will have a national healthcare system in this country in probably 10 to 20 years from now. And I think it's going to be because employers are going to throw up their hands and say, we're out. Now, that that will move into a system and a platform, I think, that will entail those having insurance and those not having insurance. It'll be a kind of a two-tier system, kind of like the way it works in Canada. About 90% of Canadian companies buy a supplemental plan that supplements the Canadian healthcare system. That's, I think, what we're going to have in the U.S. 10 to 20 years from now, unless we start buying insurance in different ways, eating better and exercising, and doing just a lot of different things than what we've been doing in years past.
I've been feeling like a shark in a shrimp tank, big fish, small pond in the shrimp tank.